Well, it's Tuesday, which means we're joined by somebody from Greenwood Leflore Hospitals this morning, Dr. Joseph Assini.
Hunter.
We are so glad to have you. I love when you're here. I love when you're in the kitchen. But Dr. Assini has such an amazing amount of knowledge, and whenever you come in, we always talk about, especially diabetes and how it affects the delta. When we get to talking about those subjects, can I ask a question like, what are some things, like if you're a diabetic, what are some things that maybe folks should stay away from?
Well, that's a great question. Just like you to be aware of that November is Diabetes Awareness Month, so we're going to have a good month of educational program here. But you brought this up. This is what you don't do. I had a patient last week. She was 81 years old. She had diabetes for 23 years. And when you have diabetes that long, you're prone to the complications of diabetes. And she had them all, unfortunately. She had loss of vision, she had poor circulation to the feet, and she had loss of feeling to the feet.
Right.
So that's a nasty triple play of disaster.
Right.
So she was having a toenail that was hurting her, she thought, or was long. She attempted to cut her toenail, couldn't see it, couldn't feel it, cut her toe, ended up with an infection. Now she has an infection on bone. And I think we can save the toe. However, these are the things you do not do. I beg and implore all my diabetic patients that see a professional. If you can't see, can't feel, and don't know what you're doing, you're taking a risk that you need not take. And you need to see a medical doctor, keep your sugar under control, to keep these risks down to a minimum.
Right.
And get the education. And for those of you that have family members that have diabetes, love them enough, engage them enough, and take them to the doctor.
Right.
There's no reason to run the risk of losing a toe, a foot, or a leg, particularly when you have this diabetic problem.
And when I just actually got a piece of pepper.
I got them from the kitchen.
From the
Red
kitchen
pepper?
earlier. It just hit. When people don't have that feeling, it's a dangerous thing, and we love our families,
Listen, I found people with a golf ball in their shoe and didn't feel it. If, neuropathy, diabetic neuropathy, the sugar affects the way your nerves tell your brain. So on one end of the spectrum, an elephant can step on your foot and you won't know it. I had a patient that went to the beach, put his foot in the sand. What was warm to him was actually frying his foot, okay? On the other end, you look at the person's foot and they're in agony. Right. So you need tight glucose sugar control to minimize the danger of getting what we call diabetic neuropathy. But please, if you need professional care, don't leave it to guesswork. You're only playing with a time bomb that you need not do.
Right.
I want to keep your feet, I want to keep you walking, I want to keep you healthy. If you need professional foot care, see a podiatrist or other medical doctor or anybody, but don't do it on your own. It's not worth to lose a limb.
And obviously everybody can come over to Greenwood Leflore and see you.
Yeah, I work with a great colleague, Dr. Preston Bowles, the Greenwood Leflore Foot Center. You can call us at 662-453-9004, or you can look us up on the GLH internet, glh.org. We'll be happy to guide you and care for you in the professional manner that you deserve.
And diabetes is one of those things that obviously you want to watch, every little thing you do. And that's why we love having you in the kitchen, because we get to see the little things that you can do that make you better.
All of this are simple lifestyle changes. Walking, getting care, keeping your sugar under control, eating healthier. It's part of the package, and we really appreciate WABG allowing us to get out and reach as many people as we can.
Yes, absolutely, absolutely. We love having you guys here. Thanks so much. I can't wait to go to the kitchen in just a minute. Stay with us. Coming up after the break, we have more Good Morning Mississippi, and we'll return to the kitchen and taste Dr. Assini's amazing dish.
This Health Matters segment is brought to you by Greenwood Leflore Hospital.